First thing we want to discuss is how to know when you need an orthopedic and sports physical therapist. Now, many people think you need to have some kind of injury or some kind of traumatic injury or surgery to then warrant the need for physical therapy, and that's simply not the case. Many of my patients, when they come in here and I say, hey, look, what happened? What brought you in here? How did your pain start? They always answer with the same thing. I don't know. It just came out of nowhere. That's okay. Like I said, more often than not, that's the mechanism of injury that I hear, that they don't know how it happened. That's great because usually it's some sort of muscle imbalance that is leading to the person's inability to perform their daily activities. So, when do you know that you need to have a physical therapist? We deal with two primary things, weakness and pain. Now, those two things will lead to you not having your ability to perform even basic functional activities. Standing up from your couch or your toilet, or being able to go up and down the stairs, sleeping on one side because of shoulder or hip pain, getting in and out of bed, getting in and out of your car, going shopping and being able to stand for a prolonged period of time. Anything that involves a lack of physical ability to perform a daily activity like it was so simple for you to be able to do before and now you can't, anything like that, physical therapy is your answer. If you have pain anywhere, physical therapy is your answer. We use hands-on treatment, which is myofascial release, deep tissue massage, joint mobilizations, and other muscle energy techniques to help relax and resolve the inflammation in muscle tissue. And that is the primary cause of most of the ailments people come in here with. Another thing we use is targeted stretching and flexibility exercises that we do to help relax and make more flexible muscles that are very, very tight and pulling on your joints. Another thing that we use is very important is targeted strengthening. So if we find a muscle group that's weak, we strengthen it because you're going to need that muscle group to perform a certain activity. For example, you want to go up the stairs, you're going to need your glute maximus and your quadriceps. Those two muscle groups are weak, guess what? Going up the stairs is going to be difficult for you. So when you're telling us your story as to what's limited and what you can't do, we think about and we go and we evaluate and diagnose what tissues are causing your inability to perform your activities, and then we fix it. So, if you have any kind of pain, any kind of functional or physical limitations, physical therapy is your answer. And the great thing is, you now have the direct access law, which allows you to seek physical therapy care without having to go and visit with a doctor first. That's very important. Medicare doesn't allow you to. Workers' compensation and no fault if you got into a car accident, you still need to have a prescription for physical therapy. But always remember, choose the least invasive and most effective form of treatment for pain and weakness, physical therapy.